Hello, I'm Gerard Ingham, one of the directors of Springs Medical, and with me today I've got Leanne Potter, who's our clinical team leader. Hello, Leanne.
Hi, Jared.
And we're meeting in a strange way, and we're doing a strange video this time. Can you explain why is it that we can't sit together?
Yes, Jared, as you know, we've got COVID-19 out there in the community, and we are actually participating in social isolation. We've split the teams in Springs, the medical and nursing team, into two, and you're on team B and I'm on team A, so we can't work together. So hence we're doing the video sort of teleconferencing type interview.
Yeah, but we're going to use this as an opportunity to talk about it. If people are wondering about my background, it's actually not where I am. It's just a little trick because I don't want you to be seeing, what's it like in my home at the moment. We're all living a strange life, of course.
We
So,
certainly are.
Leanne, people have been really concerned about access to flu vaccines. Can you give us an update on what is happening with the flu vaccines?
Yeah, sure, Jared. We received notification from the Department of Health yesterday that the Victorian public has probably exceeded the up to the 80% mark of over 65 flu vaccines. So they're now putting a bit of a restriction on practices and service providers in their ordering, and we've been limited to how many over 65 flu vaccines we can actually get. So what we're doing here at Springs is we're still aiming to run flu clinics, and we're taking waiting lists, and as supplies come in, we'll actually start opening up those flu clinics. There is an alternative. There are other flu vaccines available on the market that can be used in people aged over 65. ATAGI, the Therapeutic Goods Department, has given the okay for that. So if we get those in, we'll be offering that to our over 65s and our under 65s as well.
So just to clarify, Leanne, there is an over 65 immunisation that has been designed to produce a slightly stronger immunity to influenza, and it was our intention to deliver this immunisation to all people over the age of 65. But because we have limited supply and because people are very keen to have their immunisation before a bit earlier than we traditionally do, we are intending to offer people the current immunisation which is used for the under 65s to the over 65s. This immunisation will produce a satisfactory immunity and will not require a booster during the influenza season.
Yeah.
They would have been planning, of course, because traditionally we provide most of the immunisations in May, and they would have been planning for us to be delivering the immunisations in May. And of course, now we've got this huge demand happening through March and April, which is exceeding their capacity to deliver. So we're having to work around that. And initially, what we were planning to have everyone ring in when we've got them available, but there's just too much pent-up demand. So we have created this waiting list. People who are on that waiting list, what will happen when the vaccine becomes available?
Yeah, when the vaccine becomes available, Springs Medical reception staff will send the patient a text message and alert them to the fact that they are now booked into an allocated flu clinic and the flu vaccine has arrived and they can have it within an allotted time. Those patients that don't have mobile phones, we've taken their landline phones and we'll be ringing them also to let them know that your allocated spot in a flu clinic is now available and we'd like you to come in on this day at this time.
Okay, so people will either get a text if they've got a mobile phone, or if they don't have a mobile phone, they will receive a phone call from us.
Yep.
And if people aren't already on the waiting list, they just have to ring up to join the waiting list.
That's correct, yeah.
We have been running our flu clinics on Saturdays and Sundays when we've had larger numbers to make sure that we're keeping that spatial distancing, the distancing between people, to make sure it's safe.
Yep.
But we have started because our practice is pretty empty through the day now, isn't it?
It certainly is. You hardly ever see anyone sitting in the waiting room, and if you do, there's only one or two. So, yeah.
So we now realise we can run a small, a single doctor flu vaccine clinic through the week. We have started to do those and have started to do those for the under 65s.
Yes.
our target is the over 65s and those under 65s who have a chronic condition that means it's very necessary for them to have a flu vaccine.
Yeah.
Okay, that covers it. So I just talked a bit about what's happening with testing at the clinic at the
Yeah.
moment. So, currently our intention generally, if someone needs testing, most people for COVID-19, and there's been very few who've been meeting the criteria, we're generally sending them to Ballarat or Kyneton. We do have the capacity to assess people in Daylesford, but it would be, because we have to put on all the gear and we have to be mindful, we can't afford to waste. I mean, you're in charge of getting our equipment in, Leanne, and it's pretty short supply, isn't it?
It certainly is. I'm really struggling to find adequate supplies from suppliers. It seems to be scarce all over Australia at the present time.
So it's a more efficient system to send people over to the dedicated clinics to get testing, because then we don't burn through as much equipment before time. We need to save that for if and when we have a larger outbreak. So all patients who have a respiratory illness, a cough or a cold or a sore throat or a fever, they'll get seen in a dedicated clinic, respiratory clinic. That's at the end of the day. Patient comes in through a dedicated entrance for that. They get asked to wear a mask and they get assessed by the doctor to see, because we're trying to keep anyone with a respiratory illness, even though most of them are not going to be COVID-19, we're still keeping them separate from everyone else. Yeah.
Yeah, and that seems to be working really well. The people that have been directed that way, they're quite appreciative of it, to keep everyone away from them and them away from everybody else. So it's working well.
Good. Yes, you certainly don't want to cough or sneeze in public at the moment.
No.
Okay, and we've been doing telephone consultations.
Yes, telephone consultations are being received quite well. And if the doctor deems it necessary for them to actually see the patient face to face, and it is a respiratory condition, as you said, Gerard, we're utilising that back entrance and being assessed, away from everybody else with the appropriate personal protective equipment on.
It is amazing what we can do through telephone. People, prescriptions and certificates, and we are aiming to progress towards having the ability to do a few video consultations like what we're doing at the moment. Yeah, look at us. It's possible.
Yes.
So
maybe I could ask you, Gerard, what happens with our telephone consults if patients are requiring scripts? How are we managing that at the moment?
So how we're managing that is, by and large, we send the prescriptions directly to the pharmacy by email, fax or post, as the case may be. And then after that, then the patient is best to ring the pharmacy before they go. The pharmacies don't want you going in there, dropping off a script and then coming back again. Oh, you've just suddenly gone bright and dark.
Yes, the lights have gone off.
It's an automatic. If you move around in the room, they'll go back on.
Oh dear.
There you go.
There you go.
Back. That'll look good on the video.
Gosh.
There we go. So so patients will then just go directly down to the pharmacy to get those.
Yeah.
And ring before they go to check that the pharmacy has it in. There are all these new systems going on that people have to get used to. That's the only other thing to say is we are in discussions. The community needs to know we are preparing for the worst and hoping for the best.
Yeah.
But we are in discussions, and been great discussions with the health service, Daylesford Hospital, and which is Central Highlands Rural Health, which is for Daylesford Hospital, Kyneton, and for Trentham. So we're in discussions with them and with the Hepburn Shire, particularly about, because if there was a major outbreak, most people would actually be at home.
Yep.
And so we need to think about how would we safely manage people at home without them spreading the infection amongst our community, because how we manage the outbreak in our community will affect the size of the curve in our community.
That's true. And it's a stressful time, people are anxious, people are worried. We can't go anywhere over Easter. We're all to stay home, which is great. That will flatten the curve and keep the curve down. But we just ask for everyone's patience. We're trying the best that we can here at Springs to support everyone. We're as stressed as what the community is, and I think we're doing a great job here. And if people can keep that in mind, it would be fantastic.
It isn't always perfect. The phone isn't always answered as quick as it might be at other times, and sometimes people are very anxious about receiving their flu vaccine. By and large, look, I'd have to say 99% of the time people have been very appreciative and understanding, but occasionally people, and we understand that's what's going on, people are very distressed, but please, it doesn't help our day when someone is being abusive or rude or to us. So we think that it's important for us to all get through this pandemic, that we're all nice to each other. And wash our hands.
Hands, yes. Sing happy birthday twice.
Sing happy birthday twice while you're washing your hands.
Yeah.
Good. That's our final message. And enjoy your Easter break.
Yep. You too, Gerard. I'll see you on the other side.
Well, we'll only see you. We won't see you in person for a little while yet.
Yeah.
Good. Thanks, Leanne.
Bye.